Hello, everyone. I'm Sandra Siepak, and welcome to OurVentura TV. On the show today, we're welcoming Dr. Janki Shah. She is with UCLA and also discussing her work today with the American Heart Association. So we're going to talk a little bit more about that. Thank you so much for joining us on the program today, Dr. Shah.
Oh, thank you so much for having me. I really appreciate it.
Very good. Tell us more about the American Heart Association and some of the work that they're doing today.
So I'm really thrilled to be a part of the American Heart Association. I've been on their board of directors here in Southern California. It's an amazing organization. So they actually started in 1924 with 6 cardiologists. And currently there's more than 40 million volunteers and supporters across the world. It's the nation's oldest and largest purely volunteer organization that's dedicated to treating heart disease and stroke. Their primary mission is to be a relentless force for a world of longer and healthier lives.
Very good. And I know the Heart Association wants everyone to have a very full and healthy life, and definitely cardiovascular health for all. Can you touch on this a little bit too?
Absolutely. So we're trying to improve the health of Americans in a variety of ways. First of all, we're the nation's leader in CPR, or life support education and training. We work around the country to really help people at an individual level understand healthy lifestyle choices. As a clinician, as a doctor, I really appreciate that the American Heart Association is at the forefront of providing scientific, evidence-based guidelines to help me take care of my patients. And then at a broader level, the American Heart Association works very closely with lawmakers, policymakers, and the public as they advocate for changes to help protect the health of our communities. And thanks to all of our generous donors, the American Heart Association has invested more than $4 billion into research. That's more than any organization outside of the federal government. So that's pretty amazing. And the fruits of this research has led to 13 Nobel Prize winners. And in my field of cardiology alone, just many life-saving research advances, such as the first artificial heart valve. The most common procedure we do in cardiology is putting in heart stents. That was funded by the American Heart Association. Cholesterol reducing medicines, heart transplantation, and CPR techniques. So they've just done amazing work.
Very good. Let's talk more about some of the things that the Heart Association really stresses, and one of them is healthy eating and nutrition. How are we doing? Are we making better food choices these days, especially with children? How are we doing?
We are definitely doing better, but I think we still have a long way to go.
Okay.
Unfortunately, 1 in 4 Californians and 1 in 6 people in Ventura County struggle from what we call nutrition security or food security. And we know that that's one of the major social determinants of health. And it's ironic because California produces half of the nation's fruit and vegetables. But again, a minority of people here have access to that. And unfortunately, equity is really at the center of everything we do. So what we really try to improve is the fact that hunger, which is experienced greater by Black and Latinx families with children, is really a target for us for trying to improve. So we're really trying to change policies at a larger level, but also trying to do things at a local level,
okay,
to help improve access to healthy food and nutrition choices.
Good. Nicotine use still is an issue with heart health. How are we doing in that respect? I know a lot of young people certainly are still using nicotine. Is that something that the Heart Association is concerned about now?
That's a huge priority for us. So overall, through the decades, nicotine and cigarette use has come down, but unfortunately, vaping has become an epidemic, especially among middle school and high school students.
Okay.
So one thing that the American Heart Association is really focusing on and has been successful in doing in many counties, such as Los Angeles County,
Right,
is banning the use of flavored and scented vaping devices, which really appeal to the younger children and to our youth.
okay.
So they've banned that to hopefully make it less appealing.
Okay. You know, heart disease is still the #1 killer of Americans, and 1 in 3 deaths, I believe, is that correct? Is caused by heart
Yes.
disease. So let's talk about some of the prevention tips that many of us can be aware of and certainly strive to achieve.
Yeah, absolutely. So heart disease, as you said, is the #1 killer. And stroke is actually the #1 cause of disability and the #5 killer in the United
Okay.
States. 80% of heart attacks and strokes are preventable. So that's huge. And so, as you said, there's a lot that we can do
Okay.
to prevent heart disease and stroke. I would say the #1 thing is getting your regular checkups with your doctors, because there's some things you may not know about. We call high blood pressure and the silent killer, because unless you get it checked, you won't know that you have it. So getting your blood cholesterol, getting your blood pressure, getting your sugars checked to see if you have diabetes, and then treating those conditions if you have it. Smoking is the #1 most preventable cause of heart attacks and strokes. So definitely stopping the smoking and the vaping. Maintaining a healthy diet and a healthy weight is really important. And I can talk a little bit more about nutrition, but also getting adequate exercise. So what I recommend to my patients, those who have heart disease and those who are trying to prevent heart disease, which is the rest of us, is to get 150 minutes of exercise in per week. And the diet that I advocate to my patients is something called a Mediterranean diet. So it's very plant-based, whole food, really minimal junk food, processed refined foods, less red meats and saturated fats is sort of the hallmark of the Mediterranean diet.
Okay, very good. Today, we're doing a lot of work now with the challenging COVID-19 times. More people with heart disease are at risk. Is that correct?
Absolutely. So we know that, having heart disease, high blood pressure are all risk factors for when you get COVID of having a worse outcome. So the American Heart Association has invested a lot of money, first of all, into the research behind COVID and how it affects heart disease. So that's really important, especially in this time. The work of the American Heart Association never really ends. And we know that what's also a concern is, especially at the beginning, when people were just very afraid of COVID and leaving the house, people were really delaying care. So people who are having heart attacks and strokes are extremely reluctant to go to the emergency room out of a true fear of getting COVID. So we're really trying to, first of all, spread the word that if you have a true emergency, you need to go and get it taken care of. And then coming back to the nutrition issues, countless families have had limited access to healthy food options. Many patients who have lost their jobs or are underemployed have trouble paying for their prescriptions right now. So the American Heart Association is really trying to work to educate patients about the importance of still taking care of your underlying health issues.
Sure. And of course, those with high blood pressure and obesity still have, a lot to be aware of as well. That's something also that COVID-19, does go after. So we do want people to
unfortunately, a lot of the habits that we're seeing during COVID-19, I don't know if you did this, but I know I certainly at the beginning at least wasn't exercising as much because the gym shut down. And we all sort of started stress eating and eating comfort foods, and that just perpetuates people's weight problems and high blood pressure problems and makes them at even higher risk. And the concern is if this, the pandemic's been going on coming up on a year, and if these unhealthy habits persist, we're going to contribute to a further epidemic of hypertension, obesity, and diabetes. So it's really important for people to know that, yes, it's very stressful, but we can't let it impact our personal health because there's going to be long-term consequences.
Very good. So it's important to make those necessary changes to prevent cardiovascular disease, and we want to keep everybody healthy out there. Can you share the website for the American Heart Association for folks to get more information?
It's www.heart.org.
Okay, very good. Okay, well, it sounds like we're on the right track to help people, and we do hope that heart disease will be on everyone's mind, and certainly they will be aware that they can do things to prevent that.
Absolutely. There's so much that we can do.
Well, Dr. Janki Shah, thank you very much from UCLA, and also representing the American Heart Association with some great tips for all of us. And I want to thank you so much for joining us today on the program.
Thank you so much for having me. I appreciate it.
Great. And thank all of you for joining us today on OurVentura TV. We'll see you next time. Bye, everyone.